Good morning once again. So I will be presenting our work on OCT-A as a tool to assess response to therapy in intraocular tumors. So this is a case of large retinal capillary hemangioblastoma we saw in the previous presentation. So here we can see that this is a pre-treatment photograph and this is the post-treatment photograph. These tumors are large and they do usually require multiple sessions of treatment. This tumor was treated with laser photocoagulation. Post-treatment, we can see only a subtle changes, but when we do an OCT, we can see that there is resolution of macular edema. So there should be a definite response. When we see an OCT-A, we can see that there is a definite increase in signal void areas intervening in between the bright vascular signal. So it may indicate reduction in intrinsic vascularity or alteration in flow. So a tumor in which clinically we couldn't see a much of morphological change showed a definite decrease in intrinsic vascularity. So OCT-A would be helpful in understanding the response to therapy. With this outset, I'll be presenting our results. So it's a retrospective case series of 8 intraocular tumors which were treated with different modalities. OCT-A was captured prior to treatment and in subsequent follow-up visits. Manual segmentation was done to minimize segmentation errors. So this is the same tumor which I discussed in the introduction. So in this slide, we can see there are 2 retinal capillary hemangioblastomas, which is very well seen on angiogram than in color photograph. Both of them were treated with laser photocoagulation. So this is 2 months post-treatment, where we can see that a retinochoroidal scar has replaced the tumor area. But when we do an OCT-A, this area, we cannot see a vascular signal telling us that there is a complete treatment response. But here we can see the vessels are still persistent, indicating that probably the location of treatment is not right or the treatment is inadequate. So OCT-A can help us in identifying inadequacy of treatment. So this was a case of acquired retinal astrocytoma, which grew quite significantly over the past few years. So we decided to treat it with photodynamic therapy. So this is the pre-treatment photograph. This is at photograph 2 months after treatment. You can see that there is extensive subretinal exudation around the tumor, but the size almost remains the same. And this is 6 months post-treatment. We can see that the size again is almost the same. The exudates have completely resolved. We don't have a clue whether really the treatment worked, whether the tumor is stable. What is happening, we are not sure. But when we do an OCT-A, we can see that compared to this particular tumor, the intrinsic vascularity has significantly increased in the last 6 months, including at 2 months post-treatment. So it may indicate that there would be progression and the treatment would have probably failed. Coming to the juxtapapillary melanoma, so this tumor was treated with ruthenium 106 block brachytherapy. This is the pre-treatment photograph. This is 2 months post-treatment, and this is 4 months post-treatment. Definitely, there is a decrease in size of the tumor, which is evident on clinical photograph, but it's not very much pronounced, particularly the difference between the two. So when we do an OCT-A, we can see that there is a definite reduction in vascular caliber. Here we can see the vessels are so thinned out, and this change is also seen at 2 months post-treatment. So OCT-A can help us in identifying response to therapy as early as 2 months in cases with those which are treated with block brachytherapy. This is one more case of a recurrent choroidal melanoma, which was again treated with ruthenium 106 block brachytherapy. This was the pre-treatment, and this was 2 months post-treatment. Fundus photograph doesn't show any significant difference, but in OCT, we can see that the subretinal fluid has significantly come down in OCT. But when we see the OCT-A, we cannot definitely make out any much of a difference. So it may not help in all the cases. We are not sure. Probably one more reason would be the deeper location of this tumor may prevent us in identifying any change. So this is a case of diffuse choroidal hemangioma with exudative retinal detachment, which was treated with external beam radiation therapy. This is the pre-treatment photograph, and this is the post-treatment photograph. We can see that the exudative retinal detachment has resolved. And again, it is confirmed on OCT. But when we do an OCT-A, there are a lot of projection artifacts from the superficial retinal vessel, but if we ignore them, we can see that the intrinsic vascularity has definitely come down when compared to the pre-treatment, but not very much pronounced when compared to the superficial tumors. So this is one more case of diffuse choroidal hemangioma, which was treated with external beam radiation. It's a long-standing choroidal hemangioma, so there was overlying subretinal gliosis. So post-treatment, there is resolution of exudative retinal detachment 3 months later, and it is again evident on OCT. But in OCT-A, pre-treatment, we cannot identify the intrinsic vascularity due to overlaying subretinal and intraretinal fluid. So it again remains one of the limitations of OCT-A in such cases. So to summarize, OCT-A does help in identifying changes in intrinsic vascularity of the intraocular tumors after treatment, even prior to the changes in morphology or change in size. It also helps in identifying in detail about the superficial tumors such as the retinal capillary hemangioblastoma, retinal astrocytoma, and superficial portion of juxtapapillary melanoma rather than the deeper tumors. The changes in intrinsic vascularity of the tumor correlates with exudation. Presence of overlaying subretinal fluid or retinal edema can obscure the intrinsic vascularity. The limitations of our study are again retrospective nature and small sample size. But to conclude, OCT-A may help in identifying early response to therapy in intraocular tumors. It also helps in identifying the treatment inadequacy. But further studies are required to improve our understanding about this. Thank you, one and all.